The first cases of HIV/AIDS were reported in the early 1980s, primarily among gay men in the United States. The disease, initially called GRID, gay-related immune deficiency, baffled scientists as it rapidly spread, claiming countless lives. Confusion and fear surrounded the virus, further stigmatizing those affected. Soon, however, researchers identified the culprit, the human immunodeficiency virus, or HIV. This discovery marked the beginning of a long and arduous battle against a global pandemic. The 1980s and 1990s were dark times. HIV/AIDS became a leading cause of death worldwide, particularly affecting marginalized communities. The lack of effective treatments fueled the crisis, leaving many feeling helpless and hopeless. Yet amidst the devastation, a global community of scientists, activists, and healthcare workers united to fight back. This collective effort led to significant breakthroughs in understanding HIV, its transmission, and its devastating impact on the human body. Public awareness campaigns helped dispel myths and reduce stigma, while research focused on finding effective treatments and ultimately, a cure. The journey of HIV/AIDS has been marked by both tragedy and remarkable resilience. Today, while a cure remains elusive, significant strides in research and treatment have transformed the landscape of the epidemic, offering hope for a future free of AIDS. HIV is a type of virus called a retrovirus. It attacks the body's immune system, specifically the CD4 cells, also known as T cells. These cells play a crucial role in protecting the body from infections. Once inside the body, HIV targets and infects CD4 cells. The virus then uses the machinery of these cells to replicate itself, creating more copies of the virus. As HIV multiplies, it gradually weakens the immune system, making the body vulnerable to a wide range of opportunistic infections and diseases. Without treatment, HIV progresses through different stages. Initially, there may be flu-like symptoms, which often go unnoticed. As the virus replicates and damages the immune system, individuals may experience swollen lymph nodes, persistent fatigue, weight loss, and recurring infections. This stage, known as AIDS, acquired immunodeficiency syndrome, is characterized by a severely compromised immune system. Individuals with AIDS are highly susceptible to life-threatening infections, such as pneumonia, tuberculosis, and certain types of cancer. Understanding how HIV attacks the body is crucial in developing effective treatments and prevention strategies. By targeting the virus's life cycle and bolstering the immune system, researchers and clinicians have made significant progress in managing HIV and improving the lives of people living with the virus. In the early days of the epidemic, an HIV diagnosis was often considered a death sentence. However, relentless research efforts have dramatically changed the course of the disease. The development of antiretroviral therapy, ART, in the mid-1990s marked a turning point in the fight against HIV/AIDS. ART involves a combination of medications that work by suppressing the replication of HIV in the body. These drugs prevent the virus from multiplying, allowing the immune system to recover and rebuild itself. While ART does not eliminate HIV from the body, it effectively controls the virus, reducing the amount of HIV in the blood to undetectable levels. The advent of ART has been nothing short of revolutionary. It has transformed HIV/AIDS from a fatal disease to a manageable chronic condition. People living with HIV who have access to ART and maintain an undetectable viral load can live long and healthy lives with a near-normal life expectancy. Moreover, groundbreaking research has shown that people living with HIV who maintain an undetectable viral load cannot transmit the virus to their sexual partners. This discovery, known as undetectable untransmittable U, has shattered long-held stigmas and transformed our understanding of HIV transmission. Today, a wide range of ART medications are available, tailored to individual needs and lifestyles. These medications are taken daily and require close monitoring by healthcare providers. Early diagnosis and treatment are crucial for achieving the best outcomes and preventing the progression of HIV to AIDS. In addition to ART, people living with HIV may require medications to manage other health conditions or side effects of treatment. Regular medical checkups, including CD4 cell count and viral load monitoring, are essential for ensuring treatment effectiveness and overall well-being. Living with HIV can present unique challenges, including managing stigma, disclosing one's status, and navigating healthcare systems. Support groups, mental health services, and community resources play a vital role in providing emotional support, education, and advocacy for people living with HIV. Despite tremendous progress, disparities in access to treatment and care persist, particularly in low and middle-income countries. Addressing these disparities through increased funding, improved healthcare infrastructure, and reduced stigma is essential for achieving global control of the epidemic. Section 5. A future free of AIDS. Progress towards eradication. The ultimate goal of HIV/AIDS research is to find a cure, a way to completely eliminate the virus from the body. While a cure remains elusive, ongoing research offers promising avenues for exploration. Scientists are investigating various approaches, including gene editing technologies. These tools hold the potential to cut out the HIV DNA from infected cells, effectively eliminating the virus from the body. Researchers are also exploring immune-based therapies. They are looking for ways to boost the body's natural ability to fight HIV, such as developing therapeutic vaccines and immunotherapies. Another approach is the shock and kill strategy. This method aims to flush out hidden HIV reservoirs in the body and then eliminate the virus with potent antiretroviral drugs. While these research avenues are promising, significant challenges remain. HIV is a complex and adaptable virus, and finding a cure will require continued investment, innovation, and collaboration among the global scientific community. Section 6. The challenges ahead. Obstacles to HIV eradication. Eradicating HIV/AIDS presents several significant challenges. One major obstacle is the virus's ability to hide in latent reservoirs in the body, where it remains dormant and invisible to the immune system and current treatments. Another challenge is the lack of a vaccine to prevent HIV infection. Despite decades of research, developing an effective HIV vaccine has proven to be extremely difficult due to the virus's high mutation rate and its ability to evade the immune system. Additionally, social and structural factors, such as stigma, discrimination, poverty, and lack of access to healthcare, continue to fuel the epidemic, particularly in marginalized communities. Addressing these disparities is crucial for achieving global control of HIV/AIDS. Despite these challenges, the remarkable progress made in HIV/AIDS research and treatment offers a beacon of hope. Through continued investment, innovation, and collaboration, we can overcome these obstacles and move closer to a future free of AIDS. Section 7. The power of prevention. Strategies to end the epidemic. While the search for a cure continues, preventing new HIV infections is paramount to ending the epidemic. A combination of strategies, often referred to as combination prevention, has proven highly effective in reducing HIV transmission. These strategies include consistent and correct use of condoms, which remains a cornerstone of HIV prevention, providing a physical barrier against the virus during sexual activity. Early diagnosis through HIV testing allows individuals to access treatment promptly, reducing the risk of transmission and improving their own health outcomes. Pre-exposure prophylaxis, or PrEP, involves taking a daily medication that can significantly reduce the risk of HIV acquisition for individuals at high risk of exposure. Post-exposure prophylaxis, or PEP, is a short course of antiretroviral medication taken after a potential exposure to HIV to prevent infection. Harm reduction programs aim to reduce HIV transmission among people who inject drugs by providing access to sterile needles, education on safer injection practices, and opioid substitution therapy. Section 8. A global responsibility, the importance of international collaboration. Ending the HIV/AIDS epidemic requires a global response. International collaboration is essential for sharing knowledge, resources, and expertise to develop effective prevention and treatment strategies. Organizations like the Joint United Nations Program on HIV/AIDS, the President's Emergency Plan for AIDS Relief, and the Global Fund to Fight AIDS, Tuberculosis, and Malaria play a vital role in coordinating international efforts, providing funding, and supporting HIV/AIDS programs worldwide. By working together, sharing best practices, and addressing disparities in access to prevention, testing, and treatment, the global community can make significant strides towards ending the HIV/AIDS epidemic. Section 9. Hope on the horizon. A future without AIDS. The journey of HIV/AIDS has been marked by both profound loss and remarkable progress. While challenges remain, the advancements made in research, treatment, and prevention offer a beacon of hope for a future without AIDS. With continued investment, innovation, and unwavering commitment from the global community, we can overcome the remaining obstacles and create a world where HIV is no longer a public health threat. By embracing the power of science, compassion, and collective action, we can achieve an AIDS-free generation and realize a future where everyone can thrive.